Hi, my name is Professor Dr. Waqar. I am a cardiologist working as professor of cardiology. I am going to tell you about some of the few common symptoms of heart diseases. The most common symptom is chest pain or constriction or heaviness across the chest on minimal exertion or climbing up the stairs. One flight of stairs causes the chest pain, or it can radiate to the left arm or to the jaw or to the throat like a constriction. Sometimes the patient also complains of pain behind the shoulders. So this is very common symptoms of the chest heart problems with chest pain. So this is also called angina. In angina, patient it lasts only for a few minutes. So and when patient's walking and it starts, after that when patients sit down and after a few minutes this pain goes away. There are other symptoms along with that as well. If the patient with the pain or constriction of these symptoms last longer than few minutes, it may be the heart attack. So you need to go to the hospital where the CCU, coronary care unit or cardiac ward is available. So you need to go to the hospital immediately. Sometime when you put the sublingual nitrate tablet under the tongue or you put a spray under the tongue, the pain goes away sometime within few seconds or sometime in a few minutes. If it goes away within the few minutes, it means this is angina pain. But sometimes it lasts longer than that and then it goes away after 15, 20 minutes, 30 minutes. That means it may be unlikely to be cardiac pain. There are other reasons for this pain that can goes away with the sublingual tablets in a longer duration of time. In addition to these chest pain and heaviness and constriction, there are other associated symptoms like profuse sweating and dizziness, nausea and shortness of breath. And patient also the palpitation. What is palpitation? Palpitation means the awareness of the one's heartbeat. So, but sometimes people also use the word palpitation in other conditions as well. For example, when the patient feels that his blood pressure drops down, also there is a palpitation. In patient with diabetes, they have got low sugar levels sometimes. When the sugar drops, they also feel the palpitation with the heart. So these are different things. So you need to use this palpitation word in different conditions. Sometimes acidity can cause also. In addition to these symptoms, there is another cardiac symptom which is called shortness of breath, which is very common and again an important symptoms. But there are other causes other than heart. There are other causes of as well, in addition to asthma, COPD, and anemia, deficiency of hemoglobin. But in heart, there are two more important conditions like angina itself can cause shortness of breath. In addition to that, some patients have got a bigger heart. Some of the chamber of the heart becomes enlarged and its effective pumping, which is called ejection fraction, is reduced. When the ejection fraction is reduced, there is accumulation of fluid in the body, in the ankle swelling and the swelling in the legs. That leads to the shortness of breath. The shortness of breath have got different stages. Some patients have got shortness of breath on minimal exertion and doing some work. Some patients have got shortness of breath on climbing one stair of the one flight of the stairs, and sometimes just walking one block of the building. But there are some serious patients as well in which the shortness of breath is there even on sitting or lying. So such all these patients needs to be seen by the cardiologist or your doctor, and the serious patient must go and admit themselves in the hospitals. In addition to all these 2-3 symptoms, there is another symptoms which is called dizziness, vertigo, unsteadiness. And what is the cause? There are multiple causes again. The most common cause in cardiac point of view is that there is a disruption of the heartbeat. Heartbeat is not regular. Either it becomes irregular or it becomes slow or sometimes very fast. Arrhythmias, different sort of arrhythmias. Rhythm of the heart is disturbed. That can cause this dizziness. So all these symptoms are due to the heart disease or maybe other disease as well. So in the presence of such symptoms, you need to go to the hospital, you need to go to the doctor and consult with them and get the treatment. Thank you very much.